Good morning. This is Jessie. She's a 4-month-old Bichon Poodle mix, and today she's going to be getting spayed. So we're going to TPR her. She had her blood work about a week ago, and all that was within normal limits. Gotta get a weight on her. Sit still, little girl. Shh. Stay. Not too much. Jessie, over here. Stay. So little. Okay, so 6.13 today. All right. Get a temperature on her. Oh, I know, sorry. I know, wiggle one.
Silly as kid.
1019. Let's grab my sheet. So 6.13, 1019. Oh, sorry. Silly girl. All right. I'm gonna look at her gums. She still has a lot of baby teeth in there. She's nice and pink. Pink in 1 second. Pink in 1. Get a heart rate on you. You're so cute. Heart rate's fast. 160. She's a little nervous, I think. Need your aspirations? She thinks much. Okay, 40. All right, so we're just waiting on the doctor, and then we'll go over the anesthesia protocol. Typically, Dr. Jewett uses Buprenex for the pre-medication, and then for our induction agent, we use propofol. So once she gets here, we'll discuss that with her, and she can do her exam on Jessie, and then from there, we'll get started. Good morning. My name is Michelle, and I'm doing my video today on anesthesia. So I'm going to turn on the oxygen and the scavenger. Our scavenger is here on the wall. We just turn this on, and our oxygen tanks are in here, and this is the tank that we're using currently. We only run 1 tank at a time, so I just turn the knob to open. I'm going to wait for the pressure to adjust because we like to have it between 40 and 60 psi's, around should be 50. This up here is set at 50 psi's. That's the pressure that you're getting. So I'm going to wait a second and maybe just back this off a little bit so it goes down. Sometimes it takes a few minutes, so the do not touch knob everybody touches because it should be at 50, so at some point it's been touched, so we're just going to watch. I'll just do this a hair bit more, and then before we start I'll double check to make sure that it's at 50. So that's all on, and then we're going to get ready to prep for setting the machines up. Thank you. Okay, so this is our emergency drug dose reference. So we have for feline and canine. Canine is on one side and feline's on the other. Gives us the doses for epinephrine, atropine, lidocaine, sodium bicarb, calcium, magnesium. Our reversal agents, yohimbine, naloxone, and flumazine, I think it's flumazenil. Oh, sorry, pronunciation there. Okay, so we don't have an elaborate crash cart. We have what we call our emergency kit, and it's a little toolbox. And in it we have epinephrine, and we have some atropine, and we have some glyco. So the reversal agents, the yohimbine, that is in our treatment area, and the naloxone is in our drug safe. So those are things that are kept there. But in here we have things like flush, we have syringes, we have needles, available to quickly pull whatever we need along with our dose chart. The dosing chart is based on weight in pounds and then weight in kilograms, so depending on what weight we're using, generally here we use kilograms. We can quickly look and see and give the dose that we need. Also talks about, what is the reversal for certain things, how much, to give, whether to give to a cat versus giving to a dog. So it does go over quite a bit of information, and we keep that here in our surgery room. We have one here, and then we have one in our treatment area. And the little box goes back and forth depending on the severity of the patient. Okay, thanks. Okay, this is Dr. Jewett, my mentor, and I am introducing her to cute little Jessie here. I went through, she does have a lot of baby teeth left. She's 4 months old, and she's a Bichon Poodle mix, I think is what the owner said. She's very sweet and very cute. So I went ahead and did her TPR. Pretty much everything is within normal limits. Heart rate was 160, temperature 1019.
Okay.
You just checking her
Has she come in heat already? Or
nope,
no?
she's only 4 months.
Okay.
She hasn't quite made it there yet. I know, and she doesn't seem to be dehydrated or in any pain currently.
Scared.
She's petrified to be here.
Okay, so we're going to start with what is our anesthetic protocol?
Dr. Jewett likes to use Buprenex as our pre-medication, and propofol as an induction agent, and then ISO and O2 as a maintenance. So, sounds good? Okay.
And what was her temperature?
Temperature was 1019, yeah.
Okay, so we're going to get her catheter placed?
Yes.
Okay.
So as far as
And
her go-home pain meds,
And then, so post-op, we want to make sure that we're also controlling pain.
okay.
We're not chasing pain. So she'll receive either Rimadyl or Metacam.
Or Metacam.
Depends upon which one we decide to send home.
I think she's had Metacam.
Probably
for
Metacam
her,
for the
vaccine.
injections.
She's had
Yeah.
vaccine reactions
Yeah,
before
so
too.
a lot of
so
times
yes.
we'll send that already. So we'll do Metacam post-op.
She's so sweet.
And then maybe even add Buprenex later
Okay.
on tonight.
To see how she does. Okay.
Yep.
Because we do keep our spays overnight, so she'll
Yes.
be here all night, and then tomorrow morning we'll be able to reevaluate her pain. Hopefully we'll stay ahead of that, so there won't be any.
Absolutely.
Yes.
Absolutely.
Okay. Okay, so I'm getting ready for Jessie's spay procedure. I'm going to set up the machine. We've chosen the non-rebreather. It's a 1 liter bag because she is only 6.13 pounds, and our rule of thumb here is anything under 20 generally goes on this. And the way we hook it up is we have this clean air canister here, which is our scavenge system. So I'm going to weigh that. I just set my scale over here to weigh and see where we're at. It started at 232 grams. And it can go up to a total of 50 grams. So I'm gonna see where it's at. So 281, so it's over. So I need to get a new one. So I'm gonna go ahead and throw this away and grab a new can. Okay. All right, so I've got my new air can here, and then we weigh it to start to make sure that to have a good number to start at. And again, 232. And I write that on here with today's date. So the actual SodaZorb in our machine gets changed once a month. We watch for color change, but as well, it automatically just gets done once a month. We do not have a log here, but each time we use the machine, it's checked for all of those things. So this is my scavenge system for the non-rebreather, and this tube goes here. And then this goes here. So that part is all set up. So I've also selected a 4 and a 4.5 tube. I've checked them for leaks to make sure that they're staying inflated. And I've got the laryngoscope. I've also got clean clippers for once we're ready to go ahead and prep Jessie for the spay. Eye lube. We trim the nails as a courtesy here. And then I have my tie gauze over here. Got it all set, and then I think that is, I got it all. So, okay, and I'm just going to go ahead and plug the oxygen in, so that's all ready. Even though my scavenge system is set through the clean air tank, we'll go ahead and plug that in. Okay, so I've set up the area where we're gonna prep Jessie for the spay. I'm gonna go ahead and set up the OR now. Our fluid bags we use, IV fluids, we use them for 7 days at a time. This one was just started on the 28th, but we changed the extension between each patient. So I'm gonna go ahead and change this extension and prep it for Jessie. And then I'm just gonna make sure I prep the line so there's no air bubbles in here. And then here for our surgeries, we just plug our fluid line directly in with a needle, directly into the cap of the catheter. So I'm just gonna release the safety clamp so that I can get all the air out of there. See a little bit more coming through. All right, that was the end of it. So typically, if I were gonna set this up for the next day, I would put a little piece of tape on it that said new with the date and my initials to let everybody know that it was new for the next day. And then since we don't have a fluid warmer anymore, we used to have one but it fell apart. This is an IV bag that's been heated, so it's very warm. We wrap the line around the bag and then it goes inside these little thermal bags here to keep them nice and warm. So I'm going to tuck it in here. Okay. And then I'll put the whole thing in there until we're ready to start. So it keeps it nice and warm for the patient. The table is heated, so that's already on. I'm going to go ahead and put a, let me get rid of this sharps here. Sharps container. Okay. So it's on and it's ready, and I'm going to put a pillowcase on top. We have to keep the pillowcase on top because the table gets way too warm for the patient and it can burn them. And then I have gotten a spay pack out along with a small drape, and Dr. Jewett generally uses anywhere from 2 to 3 out on these little guys. So I've selected Vicryl 3 out and 4, and then as far as a skin suture, Supermed 3 and 4. And then once we get started, I'll go ahead and set the electrocardiogram machine on. This is my ground plate, which I will put underneath the patient. And this is the actual hand piece, and I'll hold that for the doctor while she wraps it with the sterile wrap once we're ready to begin. So I'm trying to think. The machine we have set up out there where I will be prepping Jessie. I'm gonna have to move that machine with her and then we'll plug it in here. This monitor is our ECG. It's a SurgiVet. Has ECG, blood pressure, pulse ox, and capnography. And I've already set it, it's in suspend mode. It is set for Jessie right now and set on dog. So it'll be all set for when she gets in here. And I believe that is it for the moment. Okay, so we're gonna go ahead and pre-med Jessie. We have selected Buprenex per Dr. Jewett's protocol as the pre-medication, and we're going to be giving that IM. And I have,
you know, the culturing and then
there's the Buprenex bottle, and I have 0.09 as my dose. I'm going to go ahead and give that IM.
And so, of course, we didn't have, I mean, our ultrasound is nothing, you know, it's nothing fancy. But she was, you know, she was concerned with the images, how thick those.
All right, so we're gonna go ahead and let that kick in, and then we'll go ahead and place her catheter. You did so good. Okay, so we're gonna go ahead and shape our catheter.
Oh my god. Oh. Well, then I just need you done. And you don't even need money? I'm sorry.
The leg is a little crazy. Sweetheart. My gloves on.
Can I try something?
Let's start with my scrub. The solution. gonna try the 22. You think? I'm gonna try 22. There on their skin. I know, it just stuck. Shh, I know, baby girl, I know. You're being so good. Hold on. And hair. You're being such a good puppy. Gotta flush. See if you feel there. Ready? Yay! Let me make sure that cap is nice and tight. Okay, I'm gonna put one more piece of tape on. And we're gonna get ready to get started here.
Otis is ready to go home from grooming.
Okay. You're a cool puppy. All right, so there, our catheter is all placed, and we're gonna get ready to start our procedure. To anesthetize her. I'm gonna double check, just listen to her heart, make sure she's down stable. Sounds good. She's just nervous and she's panting. All right, y'all ready, baby girl? Yeah. And we have our little Cardell machine set up to hook her up to for monitoring until we transfer into surgery. Okay, got all my tubes, they've all been checked. I'm gonna try this one first. All right, I'm gonna flush your catheter. I know, you're so cute and you're so nervous. Good. I know her teeth are even cute. That's how cute she is. Uh-oh, your tongue is slippery. Give it back. Size of a cat. Yep, that's a nice fit. Got a visual on that there too. All right, let's get you tied in. Oh, good girl. You can go ahead and just put on her back and then inflate her tube here. We've got her on the non-rebreather as we stated earlier. Because of her size. Go ahead and hook her up. I'm going to have to prop something up there so that And her oxygen flow was 0.4, but we're gonna do 0.6 because the doctor had said they wanted a minimum of at least half. I'm gonna put her on 2 for anesthesia. Okay, let me hold that while I grab a towel. I need to grab a towel real quick. Okay. All right, so I'm going to take over monitoring now. And Ashley's going to get her all prepped.
Clock in real quick, Lauren, and I will.
Oh, take your time, that's fine. What do you call that one? Yeah, that one. She goes to the thing. She did okay, she did after everything with her.
I'm gonna lube her eyes too. And I have her on 3.5 right now. I'm trying to just make sure we get her to a good plane of anesthesia here. She's still blinking, so she's not quite there yet. She looks like she's ticklish. Tickling, tickling. Okay. Heart rate's 150 is what I got earlier when I was listening. And the machine's showing 143. It's so warm. Turn the sugar just to here. Took her down to 2.5. She's really ticklish. She's so cute. And 140. Are you trying to express her bladder? She's got one. She does. Do you want to paper towels? Get the temperature real quick. Okay. There's a good breath on her own. And about 20 respirations. Pulse ox is reading 94%. 100.6. Give her a breath or two. Beautiful girl. Should trim her cute little nails, but it looks like she was just groomed, so I'm not going to attempt to trim her nails because I think they just did them. And we'll hook her up to fluids when she gets into the OR. We're just getting all prepped out here before we wheel her in. We're going to have to keep her on this machine, so we're going to have to move her and the machine when we get in there. Or to get in there, sorry. Gum color is nice and pink. Pink and 1 right now. Doing okay, little girl. She's a little bit puppy poke.
But I was told that.
They're too short. She just got groomed. I pulled it out to do it, but I know, because she just had her nice new puppy hairdo. I feel bad about shaving for catheter, but Okay, we all set to move? All right, let's give her a couple more breaths. We'll get her into surgery. And that was a 5 that we put in. We discarded no propofol. Okay, alrighty. Just get my mask on. I'll get her moved. Okay. Yes, I will take the puppy. You can have the machine. Thank you. Yeah, just give her one more breath. Okay, good. Thank you.
So I just took a moment to zap that as well.
I know the mat's on the side. Got it. Stuck. There we go. Oops, I forgot her pillow. Get it in a second. Thanks.
Hey Lindsay, can you grab me that pink towel when you get a chance? That pink towel.
2.5.
Thank you. No, I think I'm good.
Just gonna hold it for a second. So, thanks. Perfect. All right. Get you tied down. Let's see, crisscross. Didn't do it crisscross, or will she be okay that way? Yeah. Let me try. This thing doesn't want to hold her. I see the tire really crisscross on my mouth. Get her hooked up. Okay. All right. Just like into the red one. There it is. Sorry. Oh my goodness. We're all tingly. There's more wires than there is dog. Alright, she's kind of crooked. Let's see if I can get her uncrooked. I'm gonna put the camera on front too. We have a capnographer, so I'm gonna hook that up to her. Hold on, little dog. Eyes are fixed a little bit. I don't know. There you go. Okay. I need a smaller blood pressure cuff, so let me get that. I just realized that the one that's on there was larger. You turn it. Okay. I need to go on the other side there. I don't know if it's too much of an angle for her. Because it's like pulling. Don't need more. The bag tends to outweigh the dog. Okay, and so we're just waiting for Dr. Jewett, and once she's scrubbed in, then we'll get Jessie at a better anesthesia plane, and then Dr. Jewett will come in and start the spay. Okay? Okay, so I'm gonna hook Jessie's fluids up. We just take the needle and put it directly in the catheter cap here. All right, and her fluid rate is 27, which I calculated at the 10 mgs per ml per kilogram. So I'm gonna go ahead and press start. Oh, there it goes. Okay, so it's all set.
Hey, this,
It's missing towel
this
clamps.
pack, yeah, I mean, not that I don't.
You don't use them, yeah.
This top, this one's missing one.
I knew it was missing the towel clamps. They had to be sent out for repair.
It's okay with them. Call them, right? I can set up a discharge time for tomorrow and everything.
That was pretty routine.
Yeah, that was pretty good.
Yeah, I just want to tell her, we probably will call her back if we don't need to, if she doesn't have any questions.
Yeah, that's fine. And also, if you want to ask, what their pharmacy is.
Okay, that's
So
what
we can
because I do want to do the balance
So we
system.
can-
Okay.
Yeah, that's what the meeting's value now.
Okay, all right, thank you.
Thank you. Michelle, did you want to get that for me?
Thanks.
How's she been doing?
She's been doing good. Mm-hmm. I got her on 2.5, and she's staying right around like the 158. So she started out at like 160. So
Well,
it's
that,
really tiny.
well, no, it was
Oh.
not properly wrapped.
Oops. Hope that's not got mine issues on.
I don't know.
I did teach Lucy how to
Did
wrap
you?
them.
Now you see
Blame it on
it,
Lucy.
now you see it, now you don't. Patient be gone.
Oh, don't make her gone. She's so cute. I love her.
Can't cut
Straight line.
a straight line. Okay. All
I
right.
want to give her a couple breaths before you cut.
Yeah, is she bucking?
Nope, she hasn't. She's on the
She's on the- I was gonna
non-rebreather.
say, she's on
She's
the
so
back,
tiny.
yeah.
I put her on the non-rebreather just because she's too tiny. Yeah, the towel clamps we had to send out to get fixed. We knew that they were missing.
There was one other instrument that was,
Since you guys don't always use them, we didn't worry about
I
putting
don't.
another one in there.
I don't remember using. There was something, I got touched. I need a new glove.
Uh-oh,
The back of this finger touched
touched
the
the
cord.
cord. Shoot. All right, let me get another one.
I'll have them get one.
Another glove.
Lucy, or Lindsay, I need another
This
glove.
thing is hard to get.
Yeah, it's my glove touched.
I'm gonna give her a couple breaths while we're waiting. Her gum color is nice and pink. About 1 second. Refill time is good. It's kind of hard to get respirations when they are under the drape. So it's nice to have the monitoring equipment, but I'm checking them now before we get started. She's doing a good job breathing on her own here. I'm getting about 20. She's still on 2.5.
All right, is she grounded?
Yes, ma'am.
All right, you
It's
ready?
doing good. Yep, I'm gonna give her a couple breaths. She's a little stinker. I'm gonna turn her up just a hair. All right.
Okay, thank you. Ready? I'm cutting.
Sorry, I'll stop breathing.
Yes, I'm cutting. Really?
It's not working. It's on.
Not
No,
working.
she gave you the correct one.
Not
Are you
working.
serious? It's the one we just used. Can you wait to see it? Are you kidding me? She must have swapped them out on me again.
Uh-huh. You wanna check on the other?
Yeah, I'm gonna try the other side. Hold on.
I don't think that's the same.
I don't
one,
think it
Michelle,
is. I don't think it's the right one. Try. See if that works now. Earlier, someone was checking to see if hand pieces were working, and I think they swapped them out on me. Oh, lordy. Okay. Give us just a second to switch that out. Technical difficulties here.
No, this is the
Hey,
one.
Krista.
Why does Krista mess with things?
I need the Allen handle back. So somehow they got flip-flop. The one that's plugged in is not working. So I need the working one. Will you be able to use the tip if I get you a new wrap?
Yeah, that's what I was thinking.
Was
So
that
how-
did switch and all that?
Yeah.
So, Michelle, what we need to do is,
Just remove the.
I'll hand it to you, and then you're
I can
gonna
unwrap it. and
pull
pull-
this,
Yeah.
no, you just pull
We'll just
it
do that,
down.
and I can do that. Yeah.
You can undo it, and then I'll grab the tip, so I can use the tip.
Yep. I'll get you another wrap. Sorry. Let me just pull some further. Oh, I put that on there tight. Okay, this thing's been giving us our time. First it touched the glove, now it doesn't work. Okay, so let me get that one plugged in. I think we had it over here, actually. Okay. And we throw another wrap in here. Oh, that. I think that must be the broken one then.
Why don't you pull it, grab it out of here so we know. We don't use the same one again. Okay.
I think the one that we were testing was the one we were using the whole time
I-
and not realizing.
I think so too. I agree. I think that's probably happened.
Okay. You let me know where you want to go with this wire so I don't touch you again.
You can just drop it.
Okay, I dropped. And I pulled 3 and 4. Do you think that's okay?
Yeah.
I know she's kind of tiny, so I didn't
She's
know.
teeny, yeah, we'll see when I
Okay.
get here. Okay, so can I
You're grounded, yes ma'am. And she should be nice and happy.
Don't bag her.
Okay, I won't.
Not yet. Yes, that would be the one that.
Hey, that's the one that works.
Oh, yay.
We fixed our experiment, sorry.
All right.
Oh, look how tiny that incision is, it's so cute.
I'm going to, I'm actually gonna go up. Oh, can you flip
Yeah, I
it?
can flip it, the pedals.
I'm actually surprised it's not higher up with
Dr. Baker.
Baker.
Our other 2 doctors are about 6 foot tall, so makes it fun.
Oh, it's because she did the toe amputation, so she was sitting.
She was sitting, yes, that she had it low, that's the only reason. All right. Alrighty. Okay. Oh. I'm just gonna sneak under here so I can get a listen.
I'm gonna go that. I'm going to do that. Whoa. We got some fat on her.
Once you start pulling, hopefully she stays happy. Do
Well,
you want me to go ahead and open 3 or 4?
hold on, let me
Or
get
just
in
wait?
here and
Okay, see how tiny she is once you get in there?
Yep.
Are your lights okay? I meant to ask.
Yeah, you're good. It's kind of strange how they're set, but
Yeah,
actually I can see.
She's so tiny.
She is. How much does she weigh?
6.13, a whole 0.13. She's like Minnie, my little dog.
Oh my god, look at this. It's like a cat.
Tiny little eaters.
Oh my dear lord.
I think her one little piece of chunk is on your glove. You
Yeah,
see?
it's her fat.
Her one little piece.
Little fat piece.
Just wait till we get a couple breaths.
Okay.
I'm not gonna mess
I'm
you up.
I'll hold on.
She says, while you guys are talking about how cute I am, that I can feel what it is. You changed videographers. Thank you.
Actually, believe it or not,
Is she bigger on the inside than your
I'll take,
thing?
well, the vessels. I'll take a 2 on.
2 what? Okay, let me grab that
I'll
then.
do 2 and then 3.
She tricked us.
Yep. I'll do 2.
I pulled 3 of the Supermed. Just wasn't sure.
Does she have anybody else at home with her?
She does. She has her sister. Oh golly, the one that I keep accidentally calling her Sophie. I keep calling her sister's name. Here you go. She says, my vessels don't want to go. Leave them alone. She's gonna get a microchip today too, so we'll do that after we're done with the procedure.
Okay.
Um,
A lot of fat.
She does for a little dog. She says, oh, so cute.
Look at that. Look at that.
Oh, wow, look at all that. Well, you're chunky for 6 pounds.
Is that Jessie?
Mm-hmm. I love
She has a
her.
lot of fat.
She didn't look chunky.
I sort of feel like I'm doing ferret surgery.
Or guinea pig.
Hedgehog.
Oh yeah, we did the hedgehog. I forgot about that. 2 hedgehogs in one day. That was fun. But theirs actually was bigger.
It was.
It was huge.
In
I've never seen
comparison-
anything like that.
Well, it's because they had the pie.
Yeah, they had pyros, but still. I didn't expect them to be quite as large as they were.
I agree.
In relation to the size of the animal.
Yep.
It's crazy.
Yes, it is. She sounds like she's steady.
Mm-hmm. Sorry, I'm just trying to sneak under here.
That's fine. She's not that big.
There's not enough room for both of us.
Suture is like bigger than the dog 3 times over.
Oh, my calculator disappeared. That's okay. I'll survive. 145. Do that math in my head. Got this. SpO2, 96%. Blood pressure, 112/76. My map is 88. I'm not sure what cuff is. Not included under there.
Did you, now that we had her under anesthesia, did you look really well in her mouth to make sure she
I-
doesn't have any? I didn't see any retained deciduous.
I don't see anything retained, and what I do see is loose. And so I think that she's probably gonna lose them.
Well, we'll need to make sure on her home care that we do right, that she comes back in
Yeah.
about a month or 2 to just make sure that
Right.
we don't have any surprises later.
Yeah. Her mom's pretty good. I think she'll follow up. It's funny because their other one that they lost Annie and they got her.
I
to-
remember,
Yeah.
Annie.
So the funny thing is though that Sophie used to annoy Annie so bad, and now Sophie is annoyed by little
By
Jessie.
little Jessie.
So it's kind of funny to watch
Pay it forward, pay.
Yeah, pay it forward, yeah. I was the other day in the appointment, she had brought Sophie just for fun, and, you know, to come along for the ride when they were doing their pre-anesthetic blood work, but I was laughing because she's all over in the corner, like, you know, cowering because the puppy's like, oh, like all over her.
Just like she used to do
Yep,
to her sister.
exactly. When they would board, she would jump on top of Annie's head, and I'm like, oh my gosh, she's like 12, get off her head. You know, she would just sit there.
Pay it forward.
That's right, siblings pay back.
Can you do me a favor, Michelle? Can you actually, so I'm not having to reach off, can you bring the
Tray around
tray
some.
just a
Yeah.
little bit around some? Thank you.
Yeah, I lowered it because that's before the table got raised.
Yeah.
Sorry about
That's,
that.
no, that's okay.
Our other doctors, in their tallness, they forget about us short people.
So yeah, what size did you get for the skin?
I got 3.
Yeah.
That'll be good. Okay,
Yeah,
good.
yeah. You can definitely open that.
Okay.
Don't open up the 3x4 yet. I want to see if.
How you can do with it too.
Yeah. I may be able to just close with all of it.
I would normally not leave the skin, but since she has
She
the
has
other
the
one at
one at
home,
home that she's tormenting.
Yep.
Yes.
We will, just to make sure.
I didn't mention earlier, but we did check the ISO on the vaporizer and it was full. We generally refill it before the next day, so it got used the day before. So at that point, it got refilled, and so it was all set and ready to go. We like to keep them full so that if we need it in emergency, it's all set.
Yep. I think I've missed the wellnesses with this one though.
Dr. Wood's been seeing her.
Oh, is that like that?
Yep. Dr. Wood saw her the other day. When she came in. I think she just came in for like a brief and then because she had finished up her puppy stuff and, you know, we're doing a brief and then just to kind of get ready with her blood work.
She's been on the puppy class or no?
I don't think so. I don't think they do puppy classes. I think Lindsay had tried to get them to, but
They're older, aren't they?
middle-aged, I think, yeah. Just making sure I got my recording going.
So yeah, and then we'll do post-op. Because if she got sent home with Medicam
I'm fairly
for
certain that's
her
what we ended up with
vaccines,
was Medicam. Yep.
then that's fine. They can
Okay.
do Medicam.
Medicam? Okay. We'll just adjust the dose based on her weight.
Yep.
So we can give her an injection then here after she wakes up?
Yep.
Okay. Get ahead of her pain. Woo! Look at that!
She's got a lot of babies.
I know, for such a tiny girl. This says her bones. Bones are still nice and pink. Pink and one.
Suture is like way longer than the dog.
I'm sorry?
I said the suture is like so much longer than the
Oh yeah.
dog.
I just got 135 when I was listening to her. The machine's reading 139, 140, so sometimes there's a little variation there.
She's been steady though.
Yep. She's holding. She's a good girl. Go for respiration so we count you. Start to kind of get under there.
You can pull up here, or you can look at the bag too. I don't know how.
Sometimes
Is
the
she
bag,
inflated? Is
she
she
doesn't
inflating
move
it
it
too
too
much?
well.
Okay, yeah.
She's not moving it as well because she's tiny,
She's
so they've given her periodic breath. She goes,
Just a
she
little.
said, I felt that. Hitting 12.
I was like, she's not moving.
Yeah,
too
she's not
much, 'cause
moving much,
I
yeah.
usually see the drape go.
Yeah. She's doing alright though. She's in so tiny, it's hard.
Told Gracie's mom about you and the e-collar. She laughed.
Oh, because I just told them they were wasting their time.
Uh-huh.
She's a good girl.
Told you to have a little conversation with her about not
Not touching her catheter. I love Gracie. Was she happy to hear she was out? Yeah, I bet.
I said that she is not staying tonight.
Nope,
Not Gracie.
not Gracie. She has to go home.
Alrighty then. Alright, so what do you have her on?
I have her on 2.5.
Okay, so
She's been very happy there. Do you want me to wait a minute to walk her
yeah,
down?
let me look in and see what we got going on inside, and then
Okay. Those instruments, even though they were for a spay pack, look way huge in her.
probably should use the exotics.
The exotic spay pack. The hedgehog spay pack. Where's that?
Yep. Yep, that looks good. Alright, so once I close the linea, I'll let you know when I'm done, and then you can start bringing her down.
Sure. She's already lost some of the lower deciduous canines, and you can see the adults breaking through. So her teeth, I think she's doing pretty good.
So she lost the lowers, but not the uppers.
Not the uppers, but they're loose. The uppers are loose, which surprises me.
The molars also look like they were, actually the carnasal is still the baby.
Still baby too? I didn't look back that far. Look back there. She's full of kisses when she's awake, so it's hard because all she wants to
She
do is
didn't
lick
have
you.
that really yucky teething breath.
No, she didn't, shockingly enough. No puppy breath, but no stinky breath.
No, yeah.
Yeah, the carnasial still baby. But the one behind that, not so much. That one looks like it hurts. Ouch.
She'll chew on her sister.
Yes, you on each other. Yes, we have a dog, little mini Aussie that was neutered today. He's very disgruntled. He's out there making all kinds of noise.
You gotta be careful with the drugs we use on him.
Yep. He's a stinker.
I'm gonna, yeah, I was gonna say,
Do you
give me
want
the
the 2 or
3.
3?
No,
Okay.
give me the, I was trying to figure, am I gonna be able to do it or not? No, I don't think I'm gonna be
Not
able to do
quite.
it. Yeah, so just the 3 is fine.
Sure.
It's like I hit a vessel on the sub-Q here, like, really? You gotta be kidding me.
Minimal
Look at
bleeding to that
that,
point.
look at that, look at that, whoops. Look at the hematoma.
Mm.
Like, are you serious?
Goodness gracious. All that for that, huh?
Yeah, I'm like, are you kidding me? Beautiful, perfect, and then boom. She'll probably be a vicro reaction.
Yep. Little white dog with a viral reaction. She'll be back in a week with a bump. Hopefully not. She's
God, I
cute.
hope not.
If she comes back to visit, it's okay because she's cute. And then I mentioned earlier when we were setting up that the clean air can, we weigh that before. Well, I started a new clean air can today, but we weigh it after each use so that again it's ready for the next person. Sometimes if it's not dated, I will reweigh it, but generally if it's dated and someone's initials are on there, I trust that they did it. So, but when we're done with this procedure, I'll go ahead and weigh it, write the new weight and the date and my initials. So, because we track that way.
All right, so you can start
Yeah,
dropping
drop her a
her.
little bit. I'll take her down to 2.
Yep.
Well, 2.5.
Did you
Do
already
you want
give me-
glue or yeah? I
I'm
already
gonna
put
do the
the.
Superman
Okay.
just because of her sister.
Yep, that's right. I already dropped it on there. We'll need the glue for the microchip though. I'm sure that's gonna want to escape.
She's a white dog.
Yep. I don't like to stay
Probably
here.
bleed in the area, and
Mhm.
then the glue is gonna get it all yucky.
Yep. Then it should be all matted.
Is Mel green?
I don't know, because she came in today and I don't think Mel did her. She looks really cute. I think she could start a PetSmart. Yeah, we'll have to tell our groomer about that.
Mm-hmm. What do you got her on now?
2. We take her down to 1.5. No?
Does she change at all?
Yeah, I mean, she's gone from, we started out in 140, 160. Well, 160, 140, and now we're down to like the 120. So I'll give her a second.
Let me get myself going and
Yep,
then
for the
you
next
can
set. Yep.
Take her down.
Okay. She's very cute. Oh, your baby teeth. Gummies. They're a little bit lighter than they were, but not too bad. I'm gonna try to see if I can reach my thermometer under there. Not
You can take the radio surgery. I'm done.
Okay.
That's one less thing, and I'll pull this out of here.
Just so I can peek.
I'm done with all that, so you
Okay.
can look under there.
These little ones, they like to get cold. Well, that's not too bad. 97.9, and she started out at 100.5. So
Oh,
not
that's
too bad.
good.
Yep. But she might have stool in there. I didn't really examine that too much.
All right, Michelle, go ahead and knock her again.
Okay. Put down. Put on 1.5. Well, at least it's so tiny, so you don't have to put many.
That's right. There you go.
She's so little.
I think that if she would, her personality, if she would get an e-collar, I think she'd take them on herself.
She will. Yeah, she'll have her cute little e-collar on to annoy her sister with.
You have to probably beat her sister with
Yeah.
a weapon, concealed weapon. I'm telling you, the suture's like 3 times as big as she is.
Yep.
All right, I'm gonna put
One more?
one more. Yeah, you can turn her
I
on.
don't think we have any room for any more.
I ran out.
All right. Maybe holler for someone to come.
Too little, too
Who
little.
do you need?
Unless Dr. Jewett wants to do it. I don't like microchipping these little tiny guys. It makes me...
I'll do it.
Dr. Jewett can do it.
I'll
These
do it.
little ones make me want to cry.
She's a
It's a big
slave.
mini. I know, but still.
She's a
It's a
slave.
ginormous knee.
Bigger, sharp hurts less than small.
Yeah, probably, because it's more like a prickly mini. It's too bad all of our surgeries stay overnight, our spays and neuters, because I think that other little guy wants to go home.
Oh my dear Lord, yes, he's driving me nuts.
Barking, barking, barking.
Oh, that's perfect.
3:25.
That looks beautiful.
I think she'll be able to
so
wear her
cute.
bikini next summer.
3:25 into surgery, and I've got your microchip.
Nobody will even have a clue.
I'm gonna start unhooking her here. Oops, we're throwing
I'm
instruments.
always losing instruments.
322. Or, I'm sorry, yeah, 25 is what I meant, right? Not 22. Put her on her side. Jordan.
I did not have to wait.
She says, I'm almost here. I'm waking up already.
She's so cute.
She's very cute. Oh, I'm sorry, baby girl.
Oh, she's so little. Mm-hmm. She's like a little coconut.
How old is she?
It's a little coconut.
She's a good girl.
All right, ready?
If you're ready, we're ready, I guess, right?
I'm ready.
Hang on tight, Jesse. It only hurt for a minute
She's asleep.
for now. She's gonna wake up. Oopsies.
The last one you and I did, we couldn't find the
It was on
hole.
the floor. No, I'm just kidding.
It popped
It was
out.
there,
It pops
popped
out.
Where is
I'm
it?
holding the area.
There's gotta be blood.
She's white.
Yeah. Oh, she says I'm waking up.
Right there. Right there.
Well, wait. You squeeze it.
No, you need a little bit more.
A little bit more.
Yep.
For once, I'm trying to be conservative. Did it work?
We'll see. I may have to go home with the dog now.
I know.
Glued to the
Total
dog.
volume was 13.
I'm not joking. I'm glued to her.
Off.
Well, she lost a couple of hairs.
Couple hairs. Sure, her mom won't mind.
Yeah. All right.
Okay, you can go ahead and get her up here in a second.
Thank you.
Recording her fluids.
very much. And here's all her microchip
Yeah, let
stuff.
me just, I'll attach that. Put it with her stuff. Just gonna scan you real quick.
And
We glued it in there, so it better be there.
could I steal your pen? Are you done recording?
Yes. I just have to record once I extubate her.
Extubate and sign it.
98.1, that's not bad. It's going up a little. You're waking up, pretty girl. Right now, we're just giving her fresh oxygen. I've taken all the monitoring leads off because I'm hoping that she jumps up here in a second. I'm gonna turn this off since we're done. Half this stuff weighs more than she does.
That suture, and the sutures were bigger, longer than she is.
Remove the capnographer, so all the stuff is off of her. Hello, little girl. She says I'm blinking, so I'm getting there. You waking up? Yeah. Go ahead and take out oxygen. I'm gonna decup her. You did so good.
That was 3-0 Superman, right? Yeah.
Yes. I'm gonna tie her tube there. And then once I get her up and situated in her cage, I'm gonna go ahead and give her Metacam dose. We use the meloxicam injectable, and then she'll go home with the oral meloxidil.
She probably, we have
Oh, I
to
think she has it,
we have to
yeah.
double check to see if she
I have to
has it,
double
but
check her
she may
dosing,
have it.
yeah.
It's probably changed.
I think she was 2 pounds before.
Oh my gosh. Now see there, I would be worried, I would be more concerned about giving her vaccines because she's so little. Because those hurt. Okay. So here, then you just need to write when she's
Okay.
extubated. And just your John Hancock. All right. Thank you so much.
Thank you. Post-op temperature was 98. Good. Move her heart rate on her. Wake up! For heart rate. Flipper. She's still laying on the warm table, so that's working on her body temperature there. Can you swallow, pretty girl? You gotta swallow. Welcome back. Hi, there you are, little one. Hi. Oh, you're so cute. She says, I'm almost ready, sorry. Waking up. You waking up? Little fluff ball. Come on, swallow. Gonna swallow? Trying. Come on. So right now, I don't think she's in any pain. She's still feeling pretty good. Her Buprenex is still covering her for her pain. We still are gonna go ahead and give that Metacam because like Dr. Jewett said, we wanna be ahead of the pain, make sure that she doesn't get painful. Because the last thing we want is for them to feel any pain because then they're liable to not eat or, you know, go to the bathroom, do the things they would normally do. Come on, give it up. No? Come on. Let's go get you in your warm, snuggy cage. Let me see if they have her cage ready for her. And maybe what we'll do is we'll move her in there and I can extubate her in her cage. Let me just double check.
Can I ask?
Yeah.
Hey. Yoo-hoo! Hi. Lucy, is Jessie's cage ready?
She needs to eat.
She needs to eat if there's a hot dog in there? Okay, yeah,
Okay,
you're
we're
good to
gonna
go.
move her to her cage then. Okay? And I'll see if I can get her extubated over here. There, see? All this moving around is making her say, hey, what's going on? Let's move her over here.
And they never called me and told me it was off. I was at the grocery store. And thankfully I had.
I'm gonna put her in here
Dad's account. So I was able to-
on her hot dog. Oops, turn it on. Doesn't feel very warm. Just got plugged in. Come on. She doesn't want to give up her tube yet, so we're still working on that. Come on. Come on. Can you swallow? Can you swallow, pretty girl? Come on. She's like, no, I just want to go back to sleep. She's too cute. Come on. It just doesn't feel very warm. It's taking a while to warm up. There it goes. So it just takes a few minutes. You have to give me your tube. You have to. It's required. I'm trying to stimulate her so I can get her to wake up a little. Wake up! swallow.
Hi, this is Ashley. Good, how are you?
Gum color's still nice and pink. Got a little lighter as we went, but she's still pink and I give her pink and 2. I'm gonna listen to her. She's racking out again. Hi.
Okay. Great, okay. And I'm noticing any improvement in her breathing or? Okay. And he's taking the syringe, do you think?
I'm getting 120 for heart rate. I'm just gonna keep flipping her so I can get her stimulated to swallow. Every time I move her, she gets a little bit more stimulated. Oh, is that a swallow? There we go. That's it. She says, yeah, thank you. All right, so extubated, and I will record the time for that. And then after I get her comfortable in here, we will go ahead, give her her Medicam, and then check her in again in about 10 minutes. I'm gonna go ahead and give Jessie some Meloxidil, and I'm giving 0.1. We're gonna give that sub-Q, and this will be repeated tomorrow morning. So this will cover for 24 hours. Actually, it'll probably be closer to dinner time tomorrow night when they'll repeat this for the at-home payments. Okay, and I'm gonna give it sub-Q. I know, hold on. It's like, okay. All right, so I've given that, and she's almost set for her TPR. I've been watching her though, so keep an eye on her, make sure. I'm gonna check her heart rate though, her temperature and all that here in just a few minutes. Okay, so it's been about 10 minutes, so I'm gonna go ahead and TPR Jessie. Gums are full. Her refill time's a little bit slower. It's about 2 seconds there. I'm gonna try and get a temperature. She's on heat right now. We have her on the hot dog, so I wanna see what her temperature is, because it was a little low post-op. Good girl. I know. Hi, baby. You might be the cutest ever. I know. Okay, okay. It's okay. It's okay. Okay, so she's 98.7, which is warmer than she was, so that's good. I'm going to go ahead and record that here. And then I'm going to go ahead and get heart rate on her. I know. Getting 104. All right, and then let me check respirations. Getting roughly 20 there. Okay, and then I'll check her again in 10 minutes. Make sure her temperature's still going up. Okay, so I sprayed the table down with Kennel Care as well as a surgical instrument tray, and I'm gonna go ahead and wipe those down. It's been sitting for 10 minutes, so I've had some good contact time. I'm gonna wipe that down, get it all nice and clean, and then same with the instrument table here. So the fluids that we used earlier, they're only good for a week, and we don't have any more surgeries until next Tuesday. So what I'm gonna do with this bag is I'm gonna take it and we're gonna turn it into a sub-Q bag. I will put a new extension on it and a new needle, and it'll become sub-Q fluids so that it doesn't expire. So I'm gonna take this with me out of here. And then next week, depending on if we have surgeries or not, we'll set this up again. We only set them up as the surgeries come because we don't want to waste fluids. As far as the non-rebreather, everything is shut off, vaporizer's off, still full. We use very little for my procedure. Oxygen is off, and I'm gonna disconnect it. Machine has already been wiped down, the surgery bed, and everything is wrapped up neatly. We clean this with alcohol. Each time we wipe it all down, spray it, let it sit for a little bit. If we've had something that we're worried about, we'll soak it with the kennel care and let it sit for about 10 or 15 minutes for our contact time. And then it has to stay plugged in or it will come undone. So I'm gonna unplug this and unplug it from my air canister. The only thing that I do need to do is I have to weigh this air canister so that I see how much of it I've used and where it's at so that I can record that. So I'll go ahead and do that too as well before I put it back on there so it's ready for the next person. And then with this just gets sprayed and wiped down with kennel care as well. So I'm gonna spray that, let it sit for about 10 minutes. We wipe out the insides of all the tubing and we do reuse these, the non-rebreathers. So that pretty much is that for the cleanup part. I disconnected the oxygen. I'm gonna go weigh my air can and see where I'm at. I can go up to 50 grams before I have to get rid of this. I just started this one this morning before my procedure, so hopefully not too much of it will be used. And then this bag is going to be turned into sub-Q fluids. All my surfaces are wiped down. All the instruments have gone to be washed, and after this I'll demonstrate washing an ET tube so that you can see we use the Chlorohex scrub to do those, and then we inflate them, we scrub the outside, and we use pipe cleaners to clean the insides if the brushes do not fit on the inside, but I can demonstrate that afterwards. Okay, so I'm gonna inflate the tubes and wash them. We wash them with the surgical scrub. So we inflate them a little bit so that they're easier to clean. Use our little scrub brush with our surgical scrub.
Maybe I'll be able to get done.
I'm scrubbing the tube. And then I'm going to put a squirt inside the actual tube and use one of these long brushes to clean inside. Just kind of scrub around in there. Both ends, make sure we get it all. I'm gonna rinse. You only leave them partially inflated to dry so that we find that they dry a little bit better. Right, so I've rinsed both ends, and then we have a little drying rack. It's kind of like for baby bottles. So that's where they hang and they dry. We leave them generally overnight, and then they're deflated and put away as long as they're dry. I'm gonna check little Jessie here again. She's panting a little bit. So I wanna make sure that she's not overheating because we do still have her on heat. I know, baby. Let me get the little temperature. You're warming up. That's good. She's up to 99.2, so that's good. I'm gonna go ahead and take her temperature down, one, and see if she can maintain it on her own. And then I'll go ahead and get heart rate. Okay. I'm still getting the same, about 104. All right, I know. Let me check your gums. I know, we didn't do nothing to your gums. She's starting to get a little bit drooly, so we'll keep an eye on that. And our refill time's faster. We got pink and 2 that time. All right, let me get a respiration. All right, so I'm getting about 32. We turned her heat down so that she doesn't overheat, and we'll check her again here in about 15 minutes to make sure that she's able to maintain her body temperature. A surgery log, and I'm going to go ahead and record my surgery sheet here. And then I'm also going to need to record my controlled drugs that we used. So last name is Strong, owner's name is Nanelle, and Jessie. And let's see, that was Spay. And she was 6.13, risk was 1. Did Buprenex? I did 0.09. ISO O2, and then we used 1.3 of the propofol and discarded none. I'm gonna put my surgery time 2:35, 3:35, 3:25, and 3:06. Dr. Jewett and me. Okay, so that's for the surgery log, and then I will get the control drug log and do the buprenex. So I'm gonna go ahead and record my buprenex that we used. I already verified my bottle, so I'm gonna go ahead and write the date, the owner's last name and first name, patient Jessie, and then we put the species, and we drew up a total of 0.09. I discarded none. And then we'll do the math here. Oops, where's my clipboard? There it is. And last was 14 point. Come on, calculator. It's a 15 ml bottle. So 14.27 minus 0.09, 14.18. That was Dr. Jewett. And I'm going to put my initials, but also the technician that assisted me with it. Okay, so I've got that all recorded in my surgical log as well as my controlled drug log. Okay, so I'm going to TPR little Jessie again. Hopefully her temperature is maintaining. Her heat is been taken down a little bit. She seems to be resting comfortably until I disturb her. Even with all this noise. Oh good, so her heat can be turned. I think her heat's completely, it's on low right now, so we'll go ahead and turn it off because she's at 99.7. I'm gonna turn her hot dog off. She's not even really on it anymore, so. Okay, let me get her respirations. Getting 100. Oops. Let me see your little gums. Are you still drooly? Oh, not as bad. Yep, pink and two. Okay, so we're just gonna let her rest and we'll check her again in about half an hour.
I'm gonna go outside. I'm gonna go.
Okay, so the other thing I was going to mention is that Jessie appears to be resting comfortably. She had buprenex prior to her procedure, and then I gave her Medicam about 10 minutes after. So I would give her probably a pain score of about 2 right now, if at all, because she is resting comfortably. I think the biggest concern right now is that she's just still a little disoriented from anesthesia, and her temperature is coming up nicely. So we're comfortable with the way that she's recovering. I spoke to Dr. Jewett, and she's comfortable with the pain protocol and how Jessie is progressing. So with that being said, we're going to continue to monitor her. If she looks like she's in pain, we can repeat her buprenex dose before we leave this evening, and then she'll get buprenex again tomorrow morning and start her Medicam at home tomorrow night. Sweet little girl. Okay. Okay, so it's the next morning, and Jessie seems to be doing pretty good this morning. She's a little slow on eating, but she's finicky to begin with. We're gonna go ahead and do her morning TPR. She's already gone out and gone potty. Let me get your bottom. I'm gonna check her incision. After we get her temperature. I know. That's the worst part. She's still very alert this morning and seems to be in a good mood. We're gonna assess her pain. Currently, she doesn't seem to be in too much. If we do think she is, we'll talk to Dr. Jewett and we'll go ahead and give her, oh look, that looks marvelous. It's a little swollen, but we're gonna ice that, so not too bad. Dr. Jewett was worried she would end up with a suture reaction, but not too bad. Let me listen to you this morning. 140. Let's get your aspirations. Is she panting? Yeah. Oh, is it panting? Oh, we're so nervous. Okay. Let me just check your gums. And then we'll go from there. And she'll get her Medicam when she goes home tonight, and then we're just gonna pull her catheter. Oh, nice and pink and one. Okay. Let's pull her catheter. Oh. And if she needs a sedative, she'll get that at home. We send them home with ACE to kind of keep them quiet. She's a pretty good girl, so I don't think her mommy's gonna have too much trouble. She says, I'll be all ready to bother my sister when I get home. Oops. How much I know. It's going. I meant to tell you it was going, yeah. A little bit helpful, huh? It's okay. I'm glad it works. I know, there's a lot of your hair stuck. I know, 1, 2, 3, and I'll just rip it off like a Band-Aid. That probably was the most painful part of your day. And you're bleeding. I know she's bleeding, so should that shoot out of the catheter? Mm-hmm. All right. Yep, that's it. So she's all set. She'll go home sometime today after 10 o'clock. Thank you.